Hey everybody, welcome to After Hours Erinn. I'm Erinn. It's lovely to be with you tonight. I wanted to talk about tonight midwives. What is a midwife? What do they do? How are they like or unlike an OB? Where do they practice? All those kinds of what's a midwife even kind of questions. So most places have midwives. There's a few places in the United States where it's illegal to be a midwife. Which I think is, personally, I think it's ridiculous and wildly unfair to women who can decide for themselves if a midwife is the appropriate caregiver for them and their pregnancy or not. So what's a midwife? A midwife is someone who is highly trained, in fact, a specialist in normal physiological birth. That's what she specializes in. Normal birth, everything going well or within a certain realm of normal. Certain realm of normal. She doesn't do high risk birth. She only does low risk. So healthy mom, healthy baby, that's the midwife's clientele. So even within that, though, there's different kinds of midwives. So we have hospital midwives and we have out-of-hospital midwives. And within our out-of-hospital midwives, we have direct entry midwives, we have licensed midwives, we have unlicensed midwives, we have certified professional midwives, we have midwives with bachelor's degrees in midwifery, kind of runs the gamut outside of hospital. So in a hospital, it's going to be a certified nurse midwife. So she has a nursing degree and midwifery, supporting that nursing degree. She does specialize in low risk birth, but she works in a hospital setting. So if a person sees this midwife as part of their care team, then they are probably having a hospital birth. They have all of the options that a hospital provides. So if this mom decides she wants an epidural and she wants a midwife, she can have an epidural and have a midwife at the hospital. If she ends up needing a cesarean birth, then she can, she's at the hospital already, she can just go down the hall and get the cesarean. If she decides she wants to be induced or needs to be induced, then she can be induced at the hospital. These midwives have all the benefits of the hospital backing them up. They tend to also have to follow the hospital rules. So sometimes hospitals have really interesting rules about what women in labor can and can't do. And these midwives have to follow those rules. However, you are still in charge. She works for you. You don't work for her. She works for you. So if you say, this is what I want, this is what I will be doing. Yes, I know it's against hospital protocol to eat during labor, for example, but I will be doing it. She works for you. She has to say no because the hospital says no. She's probably going to actually support you, though, because that's what the evidence says. But anyway, that's a midwife in the hospital. A midwife in an out-of-hospital setting, like I said, there's a lot more variety. There's a variety in their training and experience. Licensed midwives typically have to pass some sort of test or exam. They also have to have a certain amount of clinical experience in order to get their license. So licensed midwives tend to be a good option. However, there's some really, really, really amazing unlicensed midwives that I personally know and would totally hire for my birth. These are midwives that have, 40 or 50 years of experience catching babies. They've caught over 3,000 babies. They've caught oodles and oodles and oodles of babies. And they have lots of experience. They have lots of education and knowledge. They just chose not to be licensed. Now, in the state that I live in the state of Utah, the advantage to being an unlicensed midwife is that licensed midwives agree when they sign their license that they will not attend breech or twin births in an out-of-hospital setting. So an unlicensed midwife has not signed this agreement. Therefore, it is actually legal for her as an unlicensed midwife to attend breech or twins out of hospital. So there's some advantage to choosing to be unlicensed as well as choosing to be licensed. So how do you choose? Because seriously, somebody could just read a book and say, I'm a midwife now because I read a book, because there's nothing stopping them from doing that. except people, pregnant women. So when you hire your midwife, you're going to ask her, what's your experience? What's your training? How did you become a midwife? How many clients have you had? How many clients do you take on in a month or in a year? And those kinds of things are going to inform your decision. If you have somebody that's a brand new midwife and you feel really confident with her and you feel really safe with her, she's an excellent choice. There's no reason that a brand new midwife couldn't be an amazing, amazing choice. I especially love them because they tend to be the most up to date on what the current evidence is, because they just finished their training. So I love that. But there's also midwives who are not licensed who've been practicing forever, and they're really highly skilled at what they do, and they might not have read the latest 2020 information about how the evidence on this factor of birth has updated. They might not have, but friends, they're skilled and they're good at what they do. So even if she's not licensed, she might be a really, really great example. In the United States, we have what's called certified professional midwives. These midwives undergo training either as an apprentice or in an accredited school, and they also have to do their clinical hours as an apprentice, where they go with a midwife who's certified already. And this is certified by the North American Registry of Midwives is what they're called. I have to remember what they're called. So these midwives are certified by their own board, basically. And that is coast to coast. They can be certified for that. So now you know, I guess, the differences between midwives, and that they specialize in normal, physiological, healthy birth processes. And please know that midwives are very, very well trained to handle most minor birth emergencies. They see hemorrhages. They have training in helping a baby breathe if they need to. They're able to cover most of the minor birth emergencies. But one of the greatest gems of hiring a midwife is that she knows when something becomes too risky. If a mom or her baby are showing signs that it's a little bit unsafe to have a baby in an out-of-hospital setting, she knows when to transfer care and send that mom into a high-risk category, into a high-risk care provider where she can get all the support that her or her baby needs in the hospital. So please know that midwives are not so committed to out-of-hospital birth that they will put your life or your baby's life on the line. They're not crazy. They're not witches. They just want to support women in whatever way the woman wants to be supported. So thank you for joining me. This was a little bit longer than normal. Again, my name is Erinn. You're welcome to check out my website, makinglittlemiracles.com. You've totally got this, girl.